Good afternoon. Welcome to our Friday Town Hall. I'm Libby Garvey. I'm chair of the Arlington Board. And before we get started, I wanted to just let everybody know, I think you probably do know by now, that we lost our friend and colleague, our vice chair, Eric Gutshall, yesterday to cancer, and we are all heartbroken. Eric loved being a board member and he loved Arlington. His death is a loss for us all, but especially to his family, and our thoughts and prayers are with them today and in the coming weeks. Over the coming days, my colleagues and I will be considering how best we can honor Eric's life and service. And now, before we begin our town hall, I'd like us to all pause for just a minute of silence to recognize and honor Eric. Thank you all. We miss Eric a lot. And now I will turn the town hall over to my colleagues, Katie Crystal and Matt DeFranti. Thank you.
Thank you, Libby, for joining us. One of the things that inspired me most about working with Eric was his passion and seemingly bottomless enthusiasm for civic engagement. And so I'm glad that we have this virtual forum to do exactly that today. And thank you to everyone who is joining us, either watching and texting along or joining us on Facebook. This is our third week of live updates on COVID-19 in our community. I'm Katie Crystal of the Arlington County Board. I'll be hosting and facilitating the event today. I'm so glad to be joined by my colleague, Arlington County Board Member Matt DeFerranti. We are also joined by Erin Miller, who is the Director of the Department of Public Safety and Communications and Emergency Management. And we have some special guests from the Cooperative for Hunger-Free Arlington that we're really excited to bring in today. That's Libraries Director Diane Kresh, Community Leader Abby Raphael, and Amy McCloskey of Arlington Public Schools. Thank you all so much for joining us. A couple of updates, a bit of a situation report. We know that our fight in Arlington against COVID-19 is far from over. We know that there are still challenging days ahead. Our region is again seeing the number of cases increase. In the National Capital Region, we currently have 11,314 cases and 347 deaths. Here in Arlington, we've seen 499 positive cases and 15 deaths. Although the number of cases is continuing to rise, the good news is that it's not quite as fast of a rate as we have seen in other areas of the country. And this is due to your efforts, the collective efforts of everyone in the community doing their part, often at considerable sacrifice to yourselves and your families, to slow the spread of the virus. We are asking that you continue to rigorously follow the guidelines to stay home, practice social distancing, and practicing safe hygiene. One of the things that we are particularly attuned to as we see some of the consequences of the stay-home order and social distancing is the needs of our more vulnerable community members and ensuring that their needs, like basic needs, like housing and food, are met. So I'd like to invite my colleague, Matt DeFerranti, to provide an update in a couple of those areas.
Sure, thanks, Katie. I appreciate it. This week, as far as the most vulnerable, we have reached out to as many landlords and renters as possible to ensure that everyone knows their rights and responsibilities during COVID-19. We especially want renters to know about the resources available to them as they need housing support, rental assistance, and even legal aid if necessary. So you all should know that evictions are not occurring and cannot be initiated, but we are also taking other steps, including reaching out to renters and landlords to make sure that everyone knows about this. We've also taken steps on the digital divide. Those of you on this have at least access. we've set up 2 hotspots just outside of Central Library and Columbia Pike Library, where people can walk up, bike up, or drive up to access free Wi-Fi in the parking lots. We want folks to stay connected while they are socially distancing and being safe. We also are going to focus today on hunger and food. We have so many residents that are rightfully concerned about the health of their families, as well as making sure that they have the food they need. Maintaining access to nutrition and food assistance is so important as we weather this ongoing crisis. To date, the county took the step of putting $100,000 from the county manager's contingent fund to be allocated to the Arlington Food Assistance Center, AFAC, to help support the growing need for stocking food. And following the tremendous showing of community support, 2 weeks ago, the donation drop-off effort with AFAC led to significant additional donations. Those donations and support allow AFAC to continue to provide programs for Arlingtonians in need and provide weekly free supplemental groceries to Arlington residents that are newly in need during this COVID-19 pandemic. To protect residents who are going to grocery stores as well as grocery store workers, Arlington's Office of Economic Development is coordinating with all the major grocery stores to ensure that they are protecting their staff members and shoppers during COVID-19. And we're thrilled to be partnering with Arlington Public Schools, who is continuing to provide free grab-and-go lunches from Monday through Friday at location sites and has steadily grown to now 7 sites, which can be found on the county's website, along with local businesses also offering food to those in need. We know there are additional gaps, and so we've been working on that. For some individuals and families, those gaps and these challenges are new. It will take a collective effort, all of us, stepping up to support our neighbors in need, especially the youngest and the most vulnerable among us. Today, we'll take as many questions as possible on as many topics as possible. But we do want to start with a special focus on talking about the new Cooperative for a Hunger-Free Arlington, a new initiative across the county to identify needs and quickly mobilize solutions to get food to those with the greatest need. I'll turn it back over to you, Katie, so you can introduce specifically our 3 special guests.
Thank you so much, Matt. So the Cooperative for Hunger-Free Arlington is led by Abby Raphael, a former 2-term school board chair who works on a variety of nonprofit and community organizations and has an expertise in building coalitions. Diane Kresh, the director of the Arlington Department of Libraries, and Amy McCloskey was the director of Food and Nutrition Services with Arlington Public Schools. And so we want to begin our discussion by asking a few questions of you all as the leadership of the Cooperative for Hunger-Free Arlington. And indeed, I'm seeing some good questions already coming in over the chat. Mike Cantwell, we see your questions about making sure children in all parts of Arlington have access to food. So let me begin. We'll jump right in with a few questions for you all. What is the Cooperative for a Hunger-Free Arlington, and how will you be working in the days to come?
Thanks, Katie. Our mission is to coordinate among Arlington County government, Arlington Public Schools, PTAs, the nonprofit sector, business, the faith community, civic associations, citizens, really everyone across Arlington, to ensure that everyone has sufficient nutritious food during this crisis. And we have a particular focus on those who are homebound as a result of COVID-19. To keep us focused on equity, which we know is a key value for this community, we have some guiding questions that we're going to continue to ask as we try to match resources to needs. And those are: who benefits, who's burdened, who's missing, and how do you know? The Arlington community has come together in ways that really I've never seen before. It's just remarkable how everyone is contributing to this effort. So we are monitoring all of those efforts, and we're conducting an ongoing needs assessment because things really are changing day to day. We're supporting efforts that exist and trying to expand those efforts. And those, of course, include the Arlington Food Assistance Center, AFAC, and Arlington Public Schools. They are just central to the efforts. And we're developing new methods to distribute meals and groceries to those who are homebound.
Thank you so much. So can you tell us a little more about who the partners are? Who's working alongside Arlington County government and also Arlington Public Schools to provide food for, as you were just describing, Abby, those who need it?
Hi, Katie. This is Diane. Thank you for including me on the conversation. AFAC is clearly a key player, but we're also working closely with existing programs like the Meals on Wheels programs that DHS is responsible for. And we're also linking in the Department of Parks and Recreation, their 60+ social cafe. I think the overall goal is to make sure that anyone in Arlington who is in need of food, either on an ongoing basis or a temporary basis, they need an emergency gift card or a bag of groceries, that they will have access to food, because we don't want to have anyone in these ridiculously challenging times having to worry about food. So the partnership is very broad. Abby indicated a little bit that it's growing as we've been working on it. The needs assessment, we have reached out to different partners each week, faith-based communities, food pantries. Just as of yesterday, we were in touch with the Food Rescue US, which takes unused food from corporate cafeterias and restaurants and picks up and makes them available immediately, same day, to people in the community. Right now, their pantries are a little bit slim because of so many closings, but I think that's a partnership that will grow as businesses are able to come back online. We're also working closely with the farmers markets. Some of them provide home delivery services via pre-orders. We're also reaching out to the food trucks. Again, they are another resource where perhaps a food truck could be placed in a neighborhood and provide a specialized meal for that community. So it's pretty broad, it's nonprofits, and it's a lot of individuals. As Abby alluded, the volunteerism has never been greater. So even if people collecting boxes of canned goods on their stoop, we'll make sure that they get to a resource like AFAC. AFAC, I'll talk a little bit more about AFAC as we move along, but AFAC is trying to expand their coverage. They're at an all-time high of 4,000 subscribers to their program. They see an additional 40 to 50 a day. And we're trying to expand their capacity by finding another location where they can do food distribution. So again, the community is responding really well. Just one quick housekeeping thing before we get too far along. If people who are listening today and participating want to know more, or they have a suggestion, or they want to make sure that we are in touch with another food distribution source, please email me at dcresh@arlingtonva.us, and I will be happy to be in touch with them. But we wanted to have a central location to capture some additional questions and or suggestions or offers from the community. So I'll stop there.
Thank you so much, Diane. So we're getting a couple questions about geographic distribution, knowing that the county has, Arlington Public Schools have 7 grab-and-go locations, but of course we have high-need families distributed across the county. So could we ask maybe Amy or Abby and Diane to say a little more about how we're thinking about reaching in particular students who might be in neighborhoods where there's not a grab-and-go location currently?
Sure. So at APS, we have about 29% of our students during the school year who participate in the free meals program. We started with 2 sites in walkable areas when school first closed. The USDA is allowing us to use the summer food service feeding program. And why is that important? Because these feeding sites are open to everyone. They're open to any students under the age of 18. It's not necessary to go to a certain school. It's not necessary that you attend the school during the year or that you're even participating in the free meals program. We started with 2 sites because we assessed the needs of our most vulnerable students, and we wanted to make sure they were walkable and in the best places. We have since expanded to 7 sites. We continue to assess daily what our needs are and what we need to do next. We started serving about 1,000 meals, and we're serving 2,800 meals a day. Students can pick up complete meals, a breakfast and a lunch every day, not just one. They can pick up two, and they can come without parents. Parents can come without students. We can have buddies come and pick up food for people. There's no ID. So it's truly an open site, and we're making it as easy as we can. We've accepted all waivers through the USDA, so students can come and pick up wherever they are in the county.
That's great. Thank you so much. Again, we're accepting questions. I'm monitoring them in the Facebook chat, and just want to emphasize again that we'll be taking questions by text message as well. And so we'll go to Bryna, help for our communications chief for the county. Every third question or so. Bryna, do we have any coming in over the text line?
We do. We actually have an older adult who she can afford to pay for groceries, but can't get out because she's self-isolating and she's part of that high-risk community. And the grocery stores are so overwhelmed right now with their delivery model. It's hard to get groceries delivered. So what do those folks do to get help?
That's a great question. I think it's one we've been hearing a lot. And I know, Abby and Diane, with the cooperative, you all have been thinking about not just those who can't afford food, but those who may be homebound. Can you share a little more about the current thinking or opportunities to address those needs right now?
Yes, one thing that we have been working on is establishing a buddy system. So it's so important that everyone think about having a COVID-19 emergency preparedness plan, because if you're not homebound now, that may happen. Someone in your family may become ill, and then the whole family may have to quarantine. So the first line of defense really is to have a buddy. Is there someone in your neighborhood, one or two people really, who could be backups for you, who could go to the grocery store, who could go pick up medicine for you? And if you don't have a buddy, there is a new organization called the Arlington Community Corps, and they will match you with a buddy. So if you go to arlingtoncommunitycorps.org, you could just click a link and you can volunteer to be a buddy, or you can ask for one to get those kinds of resources. We also have Meals on Wheels, which serves older adults. And so folks can access food delivery through Meals on Wheels.
Thanks. And actually, Matt, would you like to say another word or two? I know just last night, through the generosity of a partner organization in Arlington, we've been able to expand the reach of Meals on Wheels. Would you like to share a little more about that?
Sure. Yesterday, Arlington Community Foundation helped with $75,000 that the board took action to accept the gift and put it towards Meals on Wheels. And this is really Amy, Diane, and Abby have been setting up the structure that is going to help us use Meals on Wheels to expand services in this time of need. So we're at the start of that. There are some additional mechanisms that can help folks, and really it's focused on those most in need. There's a phone number for those who really are more in need than the questions seem to indicate, but there's still the resource. So it's 703-228-1300 is a place where we're going to expand the number of people who can't make it to feeding sites or to AFAC or to one of the places that AFAC supplies food to, the agencies as they're called. So that's an additional resource, that phone number. And then just so Diane can stay busy, let's just make sure DCRESH is KRESH at arlingtonva.us. If you just want that person that you can email to try and address your question.
Great, thanks. I'm seeing as well. Oh, please go ahead.
Actually, Katie, just one more addition. AFAC is also looking to deliver as many as 100 bags of groceries per week. So that's part of the expansion that they're looking at. So watch this space to see how quickly that comes online. But again, as I said at the start, we're trying to create a system, no matter your circumstances, where you live, your age, whether you can leave your home or not, we want to be able to put you into the appropriate stream to get food.
That is a fantastic point to emphasize. And I am seeing, Mike, see your questions there about concern that the grab and go model is not going to work for some APS families who may be, a number of miles away from the nearest site. And I think, Diane, that's really the point that we want to leave everybody with. No one model is going to work for everyone who needs access, needs support in our community. And the whole point of the cooperative is to ensure that there are different streams to meet people who may be slipping through the cracks of one program so that no one's going hungry. Let me also just make sure to invite any other questions. We are also joined by Dr. Erin Miller, who's our emergency manager for the county. And so if folks have questions about anything else related to COVID-19 in our community, the renter rights and landlord outreach that Matt mentioned at the beginning of the conversation, or anything else that might be on your mind, we're happy to take those questions. So there's a great question actually from someone asking about grocery stores. And this is something that we hear a fair amount. Folks are a little concerned that grocery stores aren't enforcing social distancing. Folks aren't wearing masks when they're there. There may be senior hours, there may not be. Erin, if I could put you on the spot a little bit to talk about some of the outreach the county is doing to grocery stores to try to communicate them.
Certainly, and thanks for the question. So our county's Office of Economic Development, led by Telly Tucker, has been in touch with not only regional and district staff from major grocers, but also working with some state-provided contacts, for instance, in the Virginia Food Grocers Associations and those other professional trade associations, to bring together those responsible for the supply chain and grocery stores within Arlington County. We are strongly encouraging them to implement similar standards across all of the grocery stores, and to follow some of the best practices that have been laid out. We've worked in particular with some of those stores to make it easier for them to do that. For example, there was a store that needed a little bit of extra room for loading and unloading. We were able to work with the Department of Environmental Services to make sure that we gave them some extra road space, right, to do deliveries, drop-offs, and pickups. And similarly, the board has reduced restrictions on delivery hours where they previously existed, and worked with stores to make sure that they could bring in larger trucks to accommodate additional supplies being loaded in. And so we're actively working that, and we're actively encouraging all stores to follow the guidance and best practices that we put forth.
Thank you so much, Erin. Let me go to the phones. Brianna, do we have any more questions coming in by text?
We actually have a number of questions. There's some questions about spring break worked really well in terms of 1 week's worth of food as opposed to families having to come every day. Is there any thought about kind of long-term that model and how, making it easier for families?
That's a great question. Can we ask our cooperative experts or Amy to take a stab at that one?
Sure. I know that giving groceries meals out 1 week at a time would be easier than daily, but there are some logistic concerns that we've had with getting enough food in for a week and with having enough storage space. So we are working with our vendors to get shelf-stable meals, and in the future, hopefully the near future, we'll be able to go ahead and start the weekly deliveries again. We'll pack meals on Fridays, and they'll be ready for families to pick up on Monday for the whole week.
That's great. Thank you. Brianna, we'll stay with you. It sounds like there are a few other texts coming in.
Well,
yeah, we have some questions about testing and what the testing capability is. How is the public health department engaged in testing and contact tracing? And so I don't know who wants to take that.
That's great. Erin, could we ask you to speak to that a little bit? I know you're working hand in glove with our public health chief and with your counterparts around the region and certainly with the state.
Absolutely. Thank you. So Arlington was one of the first locations within the National Capital Region to stand up our public-private partnership with Virginia Hospital Center in regards to drive-up testing. Since then, private labs have also expanded. So for instance, LabCorp has the ability to run tests, as well as Inova is offering additional drive-up, walk-up, and accessible testing options at a number of its clinics. And there are a few other urgent care for example, sites that offer testing. To the best of our ability, we've been putting that information together and making it available on the COVID website. One of the limiting factors that we see, not only here in Arlington, but also across Northern Virginia and the entire Commonwealth, is the supply chain for those testing supplies, be that the swabs that we use to collect those samples, be that the reagent in the test kits, or in fact, the number of test kits that are made available. The bulk of those supplies were being targeted over the last few weeks to hotspots like New York, like California, and like Louisiana and New Orleans in particular. Despite that, we have been able to accomplish what I consider to be a very good amount of testing, over 2,100 tests administered within Arlington. We know we need to do more. We are pressing and working with our Virginia Hospital Center partners to get them what they need by working with the state and with the federal government to make more testing supplies available. We know that that is going to be an important part of not only rapid testing and identification of cases moving forward, but also in being able to establish plans moving forward. As far as contact tracing, our public health officials have been working day and night in order to carry out contact tracing by phone, and our public health staff are being supplemented by Medical Reserve Corps volunteers. A plug for Medical Reserve Corps volunteers: if you find yourself able and you have skills, you can visit the Virginia Medical Reserve Corps website and sign up. And we've offered that link not only on the Facebook page, but also in our recent COVID newsletters. Those individuals are key to being able to carry out contact tracing, identification of people who may be at risk, and helping them to identify that they should be taking more strict measures with quarantine. We're also sending out a letter. You may have seen a press release the last day or two that sort of walks through for community members how they can carry that out and help our public health staff out in identifying where they've been and who they may have come into contact with. We know as the cases continue to increase, the burden on our healthcare system, our nurses, our doctors, our hospitals, our public health staff is going to continue to grow. And this is a way in which the community can help us out should they receive notification that they have a positive test.
Thank you so much. That actually is a great transition to answer a question that was asked about making data or request to make data on cases available in Arlington. We are sharing the number of cases as we did at the top of this session. We don't really have hotspots in Arlington at only 26 square miles. The real effort is about contact tracing and working with the individuals, connecting with those individuals who may have been in touch with someone who has tested positive. So Erin, thanks for teeing that up. The residents can expect to see more data on what that looks like, or excuse me, more details on what that looks like in their mailboxes soon. An excellent question in the comments from Ms. Aroni about are people without legal status able to receive the services you guys are mentioning? The short answer is yes, absolutely. This is really important, I know, to Matt as well as to me. So Matt, would you like to say any more about that question?
Sure. So already AFAC has served those without, regardless of legal status already, but we have taken steps over the past month to make sure that there's flexibility, and we're really serving everyone who comes and who has that request. I think the question is really, really important because we've seen a couple of communities that through the schools really and some PTAs where there's reluctance to come to get food, for example. And we want to reassure everyone that at the 7 feeding sites, and maybe Amy, you can speak a little more to this in a minute, but at the 7 feeding sites, there's not a question as to legal status at all. You are safely, there's social distancing, and you can obtain food. There's also, that's on the feeding side. On the housing side, Arlington Thrive does not ask legal status. All we ask is some indication that you live in Arlington. And so we've been trying to make sure that all communities in Arlington are served. And so that's a critical step. There's also Legal Services of Northern Virginia, which is an extra resource for folks. So those are a couple of answers to the question. I don't know, it may be, Amy, that you may want to just sort of emphasize that point as PTAs and school leaders across the county are stepping up to make sure that communities that may be worried or fearful or have been underserved get these resources.
Yeah, I just want to stress that every family is welcome to come to any one of our sites. I mentioned before that we're using the summer feeding program, and the reason why that's important is because we're not asking for any ID. We're not asking anyone's name. Anybody can walk up and they can get a meal, they can get a breakfast, they can get a lunch. They do not have to be fearful. We're not collecting any data. It's very safe. We have worked very hard to figure out how to make sure we're doing social distancing properly. We have 6 feet counted off for when kids are waiting in line, 6 feet from the table from where they pick up their meals, and then 6 feet from our staff. The sites are very welcoming. I've been working at a feeding site every day since we started. Kids are coming. It's a normal situation, and we're glad to see them. We can check in. How's it going? It's very comfortable, and it's working very well. I feel very comfortable with the safety of it, and there is no data being collected, no data being kept.
Thank you. We really appreciate that. And I actually just have to highlight a great question just came in about data on who's being served would be really helpful, the demographics at food pantries and at schools, because that would help us identify inequality or inequities rather. But I think Amy's example explains exactly why there's a tension that's hard, and asking people to share things about themselves can in fact make fewer people who really need food likely to come forward for it. However, also buried in there is a great question, because I know this is a big part of the national discussion about the inequities and racial disparities we're seeing on who's testing positive and what those health outcomes are. I wonder, Erin, is there anything do you know that's happening at the state level to try to gather that data so that we can learn from it and maybe address our medical response?
Absolutely, and so it's a great question, and I likewise saw that in the chat box and was hoping you would get to this. Arlington County, I will say, has been pressing very hard for the Virginia Department of Health, as well as other state agencies, to release what we call disaggregated data. We identified this several weeks ago when we began to see other communities reporting trends where, for instance, there was a disproportionate burden on particular races or particular socioeconomic classes. We fully support that, and as a matter of fact, I received word this morning that preliminarily the Virginia Department of Health is going to begin releasing disaggregated data. And so if you go to the VDH website, that is the official data source, right? Arlington County's public health department works under the auspices of the Virginia Department of Health, just like the others in the Commonwealth. If you go to the VDH dashboard, you'll begin to see they've started to do that. For instance, they've now got testing numbers by locality, and then they also have some additional information. We've received word that in the near future, they're going to start to break that out even further, and that's going to give us the opportunity to be able to get that information, particularly when it comes to cases and disease burden across our population.
Yeah, really helpful. Thank you. While we've got the camera on you, Erin, and before I next go to Brian again for any text questions, a couple of good questions coming in again about masks. I know our team is helpfully linked to our latest public statement about masks, but I think it'd be helpful to elevate that and to ask you to share a little more. I think the question was particularly outdoors when folks are exercising or walking their dogs. What is the guidance on cloth face coverings regarding that?
So we are encouraging individuals to follow the CDC recommendations, and that guidance is that you should be wearing a cloth face covering when you are outdoors or when you are carrying out your essential activities, for example, in grocery stores and places like that. The county is strongly encouraging that, and is working with, as I mentioned, grocery stores through our efforts of Arlington Economic Development and with our other business communities to ensure that they set those restrictions. Now, I will say that this requires some additional state support, right? So you saw Governor Hogan and Mayor Bowser within the region issue executive orders to mandate or require this. Right now, within the Commonwealth of Virginia, it still remains something that is, quote, strongly encouraged. And so we continue to look for ways that we can put these restrictions in place locally. But I think my board members can speak a little bit more about sort of the framework that they have to operate in, particularly within these times of emergencies.
Thanks for that, Erin. And I know we've talked as well that one of the things we would most like to be in a position to do, if not to enforce or fine individuals not wearing masks, is to be in a position to give masks to those not wearing them, because I think that would be the most appropriate quote unquote punishment, is to be handed a mask and asked to put it on. So I know that our staff team is working to identify how to build up those supplies of cloth face coverings so that we can do more of that proactive work out in the community. Bryna, let me go to you. Do we have more questions coming in via text?
We have a lot of them. So first, a shout out to the folks at Clarendon House and other places where staff is just doing a great job across the spectrum, touching base with members of their community, residents, clients, making sure they have everything they need. And other folks really are interested in how to donate, whether it's food or financial. Some folks have said, they've gotten their stimulus check. They don't really, they're in a good spot. They'd like to make some donations. So how is that? Is there some regular opportunity?
That is a great question, and I think really shows the generosity of this community. So let me start with one link, and then maybe I can ask our food chiefs to talk about where to donate to help the food efforts. And then Matt, we'll go to you for anything I'm missing. One of the most important places is Volunteer Arlington, which is now the home for a lot of the needs throughout the community, especially with our safety net providers. So they have links about where you can help, for example, our homeless services centers or domestic violence shelters, links to their Amazon wish lists so that you can get diapers, for example, to the families that need them, and a lot of other ways to put your stimulus check in particular to good use to donate. So let me go. Actually, I'm also seeing some good questions on Facebook about this, particularly with fresh produce. If AFAC is unable to take it, is there anywhere that can be donated to help some of these food efforts we've been describing, or any other places to donate food or time? So Abby, Diane, Amy, any thoughts on that one?
Sure, I'm happy.
Sure.
Diane,
Okay,
you go ahead
yeah.
on the produce.
All right. We're working with the Plot Against Hunger, which is affiliated with AFAC. We are in the process of identifying a place for them to be able to sort and arrange and clean and package the produce that could be then offered as supplemental to the groceries. As I mentioned earlier, we're also trying to come up with some systems with the farmers market. We've talked extensively with the fresh farm people who do deliveries based on pre-orders. So that's still something that we're working through the logistics on, but definitely there is a great deal of interest in the community, both to have access to fresh produce as well as the growers to be contributing to the cause overall. And just on the issue of donation in general, AFAC is another place that will take money, obviously, but they're also interested currently in canned goods, non-perishables, soups, tuna fish, that kind of thing. So if people want to take some of their stimulus check and purchase canned goods, AFAC would make good use of them. And I'll stop there.
So if I can add, the produce is a great example of bringing the community together. Diane brought to us this Plot Against Hunger, and they needed a place where they could wash and bag their produce. I was on a call this week with the faith community. We had done a survey of the faith community to see what kind of space they might have to make available for these kinds of things. And one church volunteered that they would be available for that. So we're making those kinds of connections all of the time. In addition, we have, as was mentioned, Volunteer Arlington. There is a wonderful program called Buy a Neighbor a Lunch. So you can go on that site, you can donate as little as $10 or as much as you'd like, and then a meal will go to someone in need, someone who's identified through our safety net organizations, and they have been raising a huge amount of money for that. There's another initiative, which is Buy a Nurse a Lunch, and that's being done by the Columbia Pike Revitalization Organization. You can donate money. All these organizations need that, and there are links, again, on Volunteer Arlington for that. And another way is supporting restaurants. There's a group website, arlingtoncando.com, where you can buy a gift card for use later to help our restaurants so that they can stay open.
That's great. Thank you. And I'm just noticing, Abby, I think that example might have answered two questions that were appearing in Facebook. One was how is the county reaching out to faith groups to help? And the other was, has the Plot Against Hunger program been halted? So it sounds like maybe the latter had been stopped temporarily while they resolved the space issue, and maybe our faith community has helped address that space issue.
They certainly have, and I think there may be other opportunities as we want to expand grocery delivery to use space in our faith community. So they've been terrific about that. And they also have food pantries. We have at least 2 faith communities that have food pantries. And one of them, just to get a sense of the magnitude of the need, Our Lady Queen of Peace served this Wednesday. 528 people came to their food pantry. That's twice the number that they normally see in a week. So the need is just remarkable. And I know that the Arlington Community Foundation has been putting out rapid response grants, and a number in the faith community applied for that so that they could add some food pantries at their churches.
That's great. Thank you. So this has been pretty comprehensive, but Matt, have we missed anything? Did you want to jump in? Any other opportunities for volunteerism, donations related to food or otherwise that you know about to share?
I think that is really comprehensive on food. I want to sort of signal to Amy, there may be other areas that you want to highlight, but first I just want to mention that the challenge that we're facing on feeding people is going to last for a while. So the Arlington Community Foundation, AFAC, what Abby and Diane and Amy are doing is helping put structure around some of these questions. So for example, Mike's question at the top, there are communities where there are more and fewer students in need, and we want to serve them, but we have to have the structures and the systems to serve them. And so the expansion of Meals on Wheels and all the work that really Amy, Abby, and Diane are doing is critical. But just, I think I'll kick it to Amy, but I would say, please know that we're seeing significant increases, not just at Our Lady Queen of Peace, but at AFAC, and they're scaling up. And so your contributions and donations, both locally through your food pantry, but also as you're thinking about AFAC over time, are going to be really important. And I don't know, Amy may have pieces to add.
Sure. So I think we're talking about in the future, and right now at our feeding sites, we're not accepting donations, but when students come back to school, the need is not going to just stop there. So students, many students have negative balances on their lunch accounts, and I suspect that will continue to grow. And it is very helpful to families if parents, if other people in the community would like to donate to their balance, so it's not something they have to worry about when they come back to school.
That's great. Thank you. Brenna, let's stay with you. It sounded like there were quite a few other questions coming in from that text line.
Yeah, there's actually a couple questions that go together about the curve. How do we know, what the real projection is? One concern is, it shows us behind DC in terms of the wave of the curve and the projections of the peak. How does that modeling work? And then also, what is the thinking about if we go back too soon and a second wave, and just what's all the thinking about that? Not just in Arlington, but also regionally.
Great series of questions. I think those are really at the top of mind for a lot of us. I think we have to stipulate a lot of things about our modeling, that it is the data that we have is based on insufficient testing, right? And the projections that we have a pretty wide range of what those forecasts might look like. And I think embedded in that question is exactly the concern, which is in a rush to reopen, actually finding ourselves with a worse second wave. I know, Erin, you were thinking about these things night and day. Do you want to share maybe a little bit about the projections we're working off of in Arlington, what we know about them, and then also how we're working to even begin thinking about that question of what are the criteria that under which we might feel confident about starting to relax social distancing?
Sure, great question. So first I'll address the modeling. So there's a number different models, and I saw some questions and comments within the Facebook chat about that. And without going too far into it, because I could spend quite a time, the IHME model, as well as the other models, the CHIME model in particular, are two of the most standard models that are being used. Now, the majority of those are running their model assumptions based upon state-specific information. The National Capital Region, as we know, particularly the 20 or so jurisdictions across Maryland, the District, and the Commonwealth of Virginia, operate in a much more interconnected and much more unified fashion than we do with some other components of our state. As a result of that, our information and our data is a little bit different. And so what we have been doing is working both at the emergency management level, at the public health director level, and I know at the elected and chief administrative officer level, to really assess what the impact and current modeling looks like for the National Capital Region if it were to be its own political entity, right? And so those models show what we call peaks in demand for hospital as well as ambulance transports and other medical capacity sometime within the next 2 to 3 weeks on some models, and as far down the road as June or a little bit later for others. And so we are continually looking at those, looking at where, for instance, the case doubling rate. Right now across the NCR, it's at about 10.5, 10.9 days that we see cases doubling. That's good news. It's slowed down. We believe from the last several days that we're reaching some sort of stabilized plateau. That makes sense, being that we're about 14 days out from when the jurisdictions implemented stay-home orders. As you mentioned, our next task really is looking at how we drive that lower. So how we continue to stay in the posture that we're at. That's why you heard the board member at the top of our call today say, keep doing what you're doing. It's working. We need that social distancing. We need those public health precautions to stay in place. But as we're looking at this, we are taking a coordinated and unified approach, much like you see the coalition of states in the Northeast, much like you see the Midwest and on the West Coast. Actually, right now, there is a regional conference call for chief administrative officers to discuss the approach to implementing these reopening or easing of restrictions. The elected officials yesterday agreed that in principle that we are going to look to do this as a region. And so, you'll see some more communications come out, for instance, from the Metropolitan Washington Council of Governments on it. But that's the approach we want to take. That's what we're looking at. We know that people live and work in Arlington and, for instance, may seek health care in another county or another jurisdiction, and vice versa. We have a significant number of individuals who come into the county every day for work. So we want to be able to take that into account. We want to be able to create a framework and structure that makes sense with our systems in mind.
Thank you so much. I think we have time for one or two more questions. I'm going to elevate one that came in over the chat from Adam, Aaron, while we've got you on camera, which is, can you say any more about the capacity, the call volumes, and the demands on particularly ACPD, your colleagues in first response? Anything about what you can say in terms of what they're seeing, the capacity that they have to handle non-COVID related crimes or incidents in the community?
Sure. So the team as a whole, including all department directors as well as public safety, meet regularly, obviously, through this incident and provide brief outs. Throughout the last few weeks, both the fire chief, Chief Pavlitz, as well as Chief Farr have indicated that they are able to handle the current call volume. We've actually seen a little bit of a drop in things like traffic accidents, for example, right? Unfortunately, we have seen an increase in some of the demands on our medical providers, 911, for example, and in some particular cases. Right now, we're able to meet the demand, and our forecast models show that we should be able to do that, even with certain staffing assumptions that are in place. And so, yes, we are forecasting out what it looks like, for instance, in New York, where they had significant numbers of the New York Police Department, as well as FDNY, become sick. We are looking at that. The chiefs are looking at that regularly to gauge impact, and right now feel confident that we are going to be able to meet any demand and continue to serve the Arlington community at the levels of service that they have come to expect.
That's great. Thank you so much. And that is an excellent reminder that we should be thanking our public safety folks, certainly our fire EMT who may be responding to the crisis, but also the Arlington County Police Department. And in fact, everyone who's out there doing essential work to keep the community running and safe during this time, sometimes at significant risk to themselves. So we really appreciate them. Bryna, why don't we take one of the last questions from the phones? And then if there's time permits, we'll see if there's one or two more from Facebook.
Great. Yeah, we have a question. It kind of all fits into the equity conversation about on various topics. So I'm just put them all under the equity umbrella. One is just about access to Wi-Fi and, how are we going to help people kind of bridge that divide? One is on making sure folks that are isolated, especially like in group homes or retirement centers, are getting access to absentee ballots for the June elections. And then, making sure that our homeless community is taken care of during this time and they have access not just to food, but to clean water and, facilities for their personal needs.
Wow, that's a lot of questions embedded in one. So let me see if I can tick off a couple of key themes. And I actually, Matt, might tee up two for you. One is about the elections, and I do think we have some indication that those are going to be moved from the governor. So Matt, if you wanted to speak a little more about that, if you maybe want to reemphasize the piece about Wi-Fi access that I know you talked about briefly at the top of our call. And then I think maybe in sort of congregate care settings, the sort of safety and loneliness issues. So, Diane, I know you've been partnering with DHS. If you want to add anything about that, or Aaron. So maybe if you guys want to gather thoughts, Matt, hit us on the digital divide piece as well as the transition in primary elections.
Sure. So these are great, really important questions on the Wi-Fi. We just this week stood up at Columbia Pike in the parking lot, a hotspot, as well as a free hotspot, as well as in the Central Library. That's a start. Arlington Public Schools has sought to expand access to Wi-Fi as well. And there are a couple of programs, low-cost programs, so that we can make sure access to Wi-Fi is much more affordable. That can be accessed. You can also call our 703-228-7999 number for more information on that with respect to Wi-Fi. There's more to do on this for sure, but we're aware of the concern and we are acting to address it through those two hotspots and more to come. On the June elections, the date of the election, of the primary election, has been moved from June 9th to June 23rd. The governor has asked it to be moved to June 23rd. I would say that there's still some distance to go. That's the likely time, but just context here, and I think, bless you, I think that Aaron kind of touched on it. We are doing all we can to bend and try to now crush this curve. And so we're trying to focus on safety and those steps that Libby mentioned at the start of staying home. And the questions with respect to the elections, they're important and they're timely, but we don't know the final resolution because we don't know if the governor's emergency order is going to be lifted on June 10th. There hasn't been a final call on that. At the very least, it will be moved back to June 23rd. And you can request an absentee ballot for that election already, and just the COVID emergency is enough of a reason to vote by mail. So those are a couple of steps with respect to the homeless. That's something that we've been working on over the last 2 weeks, making sure that our nonprofit partners have our full support. It's our first responders, our healthcare providers, but also the homeless we're very concerned about. So there have been a number of safety steps taken by our nonprofit partners. So that's a start. I'm sure Diane or others may have pieces to add.
That's great. And one thing to note as well for some of our congregate care settings, whether they are transitional housing for those with behavioral health needs, homelessness services, or others, when necessary, the county has contracted to create hotel rooms that are available. And we do have a number of clients of those programs in the county there for safety. But I think embedded in that question that Brenna was sharing with us was about connection and tackling isolation at the time that we are all physically distanced from each other. So I wonder, actually, Diane, I think you and your team have been working on some ways to keep the community connected, particularly the quarantine. Would you want to share a little bit about that?
Yeah, the quarantine has just been phenomenal as a way for people to express what they're feeling about being in isolation or separated from family or robbed of their normal routines. So we've gotten a range. Some responses are humorous, some are photographs, some are quotes, some are just reaching out and connecting with other people. So that's been terrific. The third issue comes out today. And then we have an issue devoted to contributions by young people, 13 and under. Your son might be a little young for this, Katie, but
despite his prodigious poetry skills.
Well, there you go. Or maybe just stick a crayon in his hand. I'm sure he can come up with something. But that's going to be forthcoming. That's going to be terrific. But a couple of other things that we're doing too. Matt already mentioned the Wi-Fi, but we're also looking at Aurora Hills as a location to augment the Wi-Fi because it has a nice plaza area, it has a parking lot, and there's a lot of housing. So we're looking at that. There's been a digital equity task force for the last several months, DHS, CPHD, DTS, and libraries looking at ways to increase access. I mean, we've talked a lot in this program about food being fundamental, so is digital access. You have to be able to get in touch with people for basic needs. So that's something that we're continuing to work on. And finally, some of my staff are trying to launch a program called Pen Pals with seniors so that they can check in with people in some of our residential communities, our assisted living facilities, people who don't have family nearby but need to connect with somebody. The connection is so important, and the isolation that people are feeling, and just the anxiety around the time we're in. But if you don't have family, it makes it that much more difficult. So we're mindful of that. And before I cede the microphone, masks came up earlier. There are lots of people in the community creating, and they've got their Singer sewing machines out, and they're whipping up many masks. And libraries is working with cultural affairs to create some kind of production line. So I just, we're not there yet on that, but I think there are a lot of people who are using their talents in the domestic arts to create something of lasting value for the community.
That's wonderful. Diane, I think that is one of the best notes I could hope for to wrap up on. I'm going to turn it over to Matt for the final word, but let me just thank again our guests, Amy, Diane, Abby in particular, Erin especially. You all are doing frontline work right now and taking the time to answer questions and communicate about what's on folks' minds is invaluable. I want to thank as well those who have joined us today. It's really great to hear from you all, to see your comments, to be able to keep up our long tradition of citizen engagement, albeit in a different format. A final thanks as well to our team, our communications team, who've been behind the scenes programming all of this, Brian or Roger, David, and anyone else I may be forgetting. So with some concluding remarks, over to my colleague, Matt.
Thanks, Katie. And really thanks to each of you on the phone. I think Aaron's description of some of the steps that he's taking and that our staff leadership is taking hopefully gives you a sense of just how focused we are on the key needs and keeping people safe. Also, just a big thanks to Abby, Diane, and Amy. They're taking the lead. Both the county board and the whole school board are thinking about hunger, and we have been talking a lot. We are trying to keep our appropriate role of asking key questions while helping set up the structure that is really being led by the three co-chairs that I just mentioned, Diana, Abby, and Amy. So that's just a sense, there are a couple of resources that I just want to mention in closing. And one is really on a daily basis, Arlington alerts our COVID updates. Just go to the Arlington County website, and at the top is a banner that talks about our daily COVID alert, provides you information. And just, I think folks should know that we're working hard. It's vigilance and discipline about washing your hands, staying home, social distancing. Those are the key steps that we need to keep taking so that we minimize the spread, minimize infections, and help you stay safe. So we're going to be continuing to work on that. There will be additional Facebook Live, additional town halls like this one to get you information. And just everybody out there, please stay safe, keep up the vigilance, and thanks for joining us.